The term obese describes a person who has excess body fat. How to tell if you're living with obesity? The most widely used method to check if you're a healthy weight is body mass index (BMI). BMI is a measure of whether you're a healthy weight for your height. For most adults, if your BMI is below 18.5, you're in the underweight range. 18.5 to 24.9, you're in the healthy weight range. 25 to 29.9, you're in the overweight range. 30 to 39.9, you're in the obese range. 40 or above, you're in the severely obese range. Obesity is a serious health concern that increases the risk of many other health conditions. The signs include type 2 diabetes, coronary heart disease, some types of cancer, such as breast cancer and bowel cancer, stroke. Living with overweight and obesity can also affect your quality of life and contribute to mental health problems, such as depression, and can also affect self-esteem. Causes of obesity. Obesity is a complex issue with many causes. Obesity and overweight is caused when extra calories, particularly those from foods high in fat and sugar, are stored in the body as fat. Genetics can also be a cause of obesity for some people. Your genes can affect how your body uses food and stores fat. There are also some underlying health conditions that can occasionally contribute to weight gain, such as an underactive thyroid gland hyperthyroidism, although these types of conditions do not usually cause weight problems if they're effectively controlled with medicines. Some medicines can also make people more likely to put on weight, including steroids and some medicines for high blood pressure, diabetes, or mental health conditions. Treating obesity. The best way to treat obesity is to eat a healthy reduced-calorie diet and exercise regularly. A specialist may prescribe other medicines called liraglutide or semaglutide. They work by making you feel fuller and less hungry. For some people living with obesity, a specialist may recommend weight loss surgery. Other obesity-related problems. Living with obesity can cause a number of further problems, including difficulties with daily activities and serious health conditions. Day-to-day problems related to obesity include breathlessness, increased sweating, snoring, difficulty doing physical activity, often feeling very tired, joint and back pain, low confidence and self-esteem, feeling isolated. The psychological problems associated with living with obesity can also affect your relationships with family and friends and may lead to depression. Serious health conditions. Living with obesity can also increase your risk of developing many potentially serious health conditions, including type 2 diabetes, high blood pressure, high cholesterol and disease, where fatty deposits narrow your arteries, which can lead to coronary heart disease and stroke, asthma, metabolic syndrome, a combination of diabetes, high blood pressure, and obesity, several types of cancer, including bowel cancer, breast cancer, and